The Pertussis Vaccine During the Third Trimester by Ann Niedermeyer, Tiffany Robinson, and Liz Goes.
Case study. A woman in her third trimester is considering whether or not she wants to receive the pertussis vaccine in pregnancy. So we're going to answer what the current recommendations regarding this vaccine in pregnancy is, what kind of research guides this recommendation, and how to present this information to the patient. What are the current epidemiological statistics around pertussis in pregnant women and neonates? And then describe the pathophysiology and clinical manifestations of pertussis in neonates, and how is this condition typically managed, and what is the prognosis?
The pertussis vaccine is included in a group called the Tdap, which stands for tetanus, diphtheria, and pertussis. And the CDC's recommendation as of 2017 is that all pregnant women should be vaccinated with Tdap between 27 and 36 weeks of pregnancy. And the sooner you get vaccinated in this time period, the better, because it allows you to set up your immune response. And then it's more effective passing it on to your infant. And it's better for the mother to get vaccinated during pregnancy because it takes about 2 weeks after receiving the vaccine to get the protection. And so that means that the mother could still catch and spread the virus to the infant during that 2-week time period. If the mother got the vaccine prior to pregnancy, it's not guaranteed that the vaccine provides protection through the whole pregnancy. So it's better to get it again or during the pregnancy. But if the Tdap is given prior to that 27 to 36 week time frame, it's not necessary to repeat it. A systematic review of the safety of maternal immunization against pertussis was done in 2019 by DeHaley and colleagues. And this review sought to, quote, identify studies that assessed the safety of maternal pertussis vaccination. And what they found was 27 different research publications that gave the conclusion that the Tdap vaccine was safe during pregnancy. So as a healthcare worker, it's extremely important to strongly recommend the Tdap vaccine to the pregnant patients because the safety of their infants from pertussis could depend on it. These pamphlets provided by the CDC are examples of how I would present the vaccine information to the patient to get the discussion started. There are also other resources available through the CDC as well, including pamphlets translated in different languages and videos about the vaccine. And during the discussion, I would let the patient know where she could go to get vaccinated. That most places don't charge for the vaccine, so that's a bonus. Some history on pertussis, also known as whooping cough. It was interesting to find out that this disease only infects humans. There's actually no other species that can contract the disease except for humans. It infects the respiratory tract, so therefore it is spread by the respiratory tract by means of a person's breath. When a person talks or sneezes or coughs, that kind of thing, the droplets become airborne. And then another person comes into contact with those droplets and it infects their respiratory tract and they become infected with pertussis. If you had a patient that was infected with pertussis, you would want to put them on a droplet precaution. It's a highly contagious disease and there's no season. It just seems to happen throughout the year, but a little bit more common in the summer and in the fall. Studies done in the past 12 years have found that anywhere between 10 and 50,000 cases of pertussis are reported annually in the United States. In the year of 2014, worldwide, in cases among children, there was 24 million. Those caused over 160,000 deaths. And since the 1980s, 1990s, there has been an uptick of cases and climbing to the largest numbers in 2012 in the United States, we saw just shy of 50,000 cases. The increase is believed to be in changes in the way we do some testing and the way we report diseases as well, along with the organism changing, and our vaccine also has changed over the years. Unfortunately, one of the highest risk populations is that of the infant. We'll see about 72 per 100,000 cases being an infant under 6 months versus 1.4 people per 100,000 being over the age of 20. Taking a look here, we'll see how. So let's take a look at the way pertussis affects neonates in pregnancy from an epidemiological approach. As we said before, it's a very contagious disease, and with neonates, that's the population where we see the most deaths occur. Since 2010, the death rate has been approximately 20 each year for infants, and in the year 2000 to 2017, 84% of the deaths were in infants under the age of 2 months. And you can see in that particular time frame, about half of the infants with pertussis were hospitalized, and about 1% of those ended up in death. During pregnancy, a woman can be considered higher risk just because of the physiologic changes going on in her body. There's decreased lung volume, a higher demand on the cardiac system and for oxygen. Her immunity changes. And studies have not found that the incidence of pertussis is higher in pregnant women, but the women that did get pertussis during pregnancy showed higher rates of the worst symptoms and needing to be hospitalized. Taking a look here, we'll see how pertussis manifests itself in neonates. It's caused by a bacteria vector, which is Bordetella pertussis. And as we said before, it enters its host through the respiratory system into the cilia epithelial cells. And as it takes up home, toxins are produced and they paralyze the cilia in the respiratory system. Inflammation begins, and it's very difficult to clear the secretions in the respiratory tract. And the antigens are able to evade the body's defenses, and so then it can further multiply. And if we think about the infant's immune system, it's immature and it's still developing. And so this puts them at a higher risk for contracting the disease, as well as developing increased complications. This is a time frame where they're very dependent on their mother's immunity, and this is why we can see the importance of a mother getting her vaccination in the 3rd trimester of pregnancy to help build those antibodies and pass them on to the infant. For babies under 6 months of age, it's not always easy for them to cough up their secretions, especially these thick ones that happen in pertussis. And so if they can't clear those thick secretions like we can as an adult, what happens is that the infant will likely stop breathing. You'll see them become cyanotic. And as mentioned before, we'll see a lot of these cases needing to be hospitalized. Infants will easily contract pneumonia because they cannot clear those secretions. And we see here again, unfortunately, that death rate being about 1% to 2%. So on top of all of this, infants can also develop seizures, hypoxia as a result of the difficulty breathing. These can lead to neurological complications. And some of the lesser concerns you might see in an infant is just poor intake due to not feeling well, also ear infections from the congestion.
Pertussis, or whooping cough, is caused by the Bordetella pertussis bacterium. So first-line treatment would be antibiotics. The macrolides erythromycin, clarithromycin, and azithromycin are for above 1 month of age, or for infants 2 months of age and older, an alternative is Bactrim. Azithromycin is the drug of choice, but babies need to be monitored for infantile hypertrophic pyloric stenosis, which can occur when given orally, but in the hospital they'd be getting it IV. Babies under 6 months old most likely need hospitalization for supportive treatment to prevent pneumonia, as pertussis can be life-threatening. So suction, oxygen, fluids, and the prevention of pneumonia and seizures are because those are the causes of mortality in neonates with pertussis. To manage symptoms at home, if it was an older child, because presumably being that it's an infectious disease, if other family members were not vaccinated, they could possibly have passed it to the neonate. So keeping the home free from irritants that can trigger coughing, such as smoke, dust, and chemical fumes, using a cool mist humidifier, washing hands often, eating several small meals throughout the day for someone who has pertussis will help because they're going to be coughing a lot, giving them plenty of fluids to prevent dehydration. You cannot give cough medicine unless recommended by a doctor to children under 4 because of potential side effects. And if you're given antibiotics, take them exactly as prescribed and finish them. And if there are signs of hypoxia, dehydration, or seizures, go to the hospital. And babies will not typically present with cough for pertussis. So it's more the signs of hypoxia and apnea that cause hospitalization. Prognosis. Prognosis of those babies who get treatment for whooping cough in the hospital, about 1 out of 4 will get pneumonia and 1 or 2 of 100 will die. Mortality is associated with secondary pneumonia, encephalopathy, cardiac failure, or pulmonary hypertension. Treatment would be intubation with hyperventilation and alkalosis, nitric oxide, and ECMO for severe pulmonary hypertension, but prognosis is poor. There were 307 deaths between 2000 and 2017, and the younger the infant, the higher the risk.